Hi there, my name is Brooke Brown. I'm a PA student working with Dr. Carlson today. Just to let you know, my pronouns are she, her. Do you have preferred pronouns at all?
She, her is good.
And your name?
Hannah.
Hannah, nice to meet you. Well, today we're going to be doing a little ENT exam, so I'm going to be checking out your head, looking at your ears, your nose, and your mouth, and palpating a few things on your throat. Does that sound okay?
Yeah.
Great. So first I'm going to start by kind of looking at your head, looking at your face, and looking at any deformities of your facial structure or any abnormalities that I can see. Then I'm going to move into your hair, and I'm just going to be inspecting, looking for any lesions, moles, lacerations, anything like that. Everything looks good here. Good. Good. Perfect. Okay. I was also looking at the quantity distribution of your hairs and stuff like that. Everything looked good. Next, we're going to be moving into looking at your ears. So first, I'm just going to take a look at your ears, noticing the auricle, the tragus, and your lobes. Looking at your mastoid process, making sure that's not inflamed or, inflamed. Then I'm just going to palpate here real quick. Tragus, mastoid process. Any tenderness here? Nope. Great. And I would do that bilaterally. Next thing we're going to move into is the otoscope. So I'm just going to look into your ear during this part, okay? All right. I got to remember how to hold this stuff. All right, ready? All right, cool. All right. So looked in that one, I could see your malleus, your incus, making sure that your tympanic membrane was that pearly gray color, as well as the cone of light, making sure I could see that reflection. Now we're going to go ahead and look in your other ear. Again, I'm going to palpate the helix, the auricle, looking at the auricle, the tragus, and the lobe here. All right, here we go. All right. Again, seeing that cone of light, making sure that's reflecting back at me. Tympanic membrane, again, was a pearly gray. I also could see your malleus and your incus, which is pretty cool. Next thing we're going to do with your ears is a whispered test. So I'm just going to stand to the side of you here, and I'm going to have you plug your tragus, your ear here, with a finger, and I'm going to whisper, and I want you to say the word back to me, okay?
Baseball.
Okay, and we're going to do the other side.
Baby.
Great. Okay. Now we're going to do the Weber test. So I have my tuning fork here. I'm just going to place it on the top of your head, and I want you to let me know if you can hear it in both ears or one or the other. Okay? So it's testing for lateralization.
Both ears.
Both ears. Okay, great. And now we're going to do, so that was like seeing the conductive and sensorineural hearing loss. Okay. Now we're going to do the Renee test. I'm going to place it on the back here. Can you hear that?
Yep.
And tell me when it stops.
No.
Okay, and then can you hear that?
Yep.
And tell me when it stops.
No.
All right, looking at the difference between bone conduction and air conduction with your hearing, which was great. Making sure that air conduction, you could hear it longer. Next thing we're gonna move into is your nose. So I'm gonna look up your nose. I'm gonna change my tip here. All right. I'm gonna get real close and personal. All right. Alright, go to this side. I gotta get a little closer, sorry. Alright, looking at both your nostrils, I did inspect your external nose before I did that. Looking for patency, your color in there, making sure it was all regular, nothing's inflamed or red. Looking for any swelling, bleeding, or ulcers, polyps, septal deviation. I didn't see any of that. Good. Yeah. Next thing I'm going to do is palpate your maxillary and frontal sinuses. So I'm just going to touch you in the front here. Any tenderness here? No. All right. And any tenderness here? No. Great. All right. Now we're going to do your throat. Okay. So first I'm just looking at your lips, and I'm going to have you open up your mouth, and I'm going to look at your oral mucosa. Great. Say ah, yeah, perfect. Looking at that symmetry, you can go ahead and stop. I was looking at your hard palate, your soft palate, making sure that your uvula was symmetric, it wasn't deviating at all. Looking at your tonsils, and I want to see your tonsils one more time here. Great. All right. I don't see any asymmetry with your tonsils. I'd give them a grade of +1. As well as then I was looking at the dorsal of your tongue and making sure that that was all symmetric as well too when you were making those noises. Okay, I also saw the anterior and posterior pillars of your mouth, making sure that those movements were symmetric with your uvula. Next thing I'm going to do is inspect the floor of your mouth. Got my gloves on here. Ooh, these are tight. Do you have another piece of gauze?
Oh no. Up top, I think.
Okay. Excuse this technical difficulties. Oops. Okay. So I'm just gonna have you stick out your tongue and I'm gonna place it in this gauze here. All right, and I'm just gonna look. Great, not seeing any lesions. Look on this side, not seeing any lesions. And then I'm just gonna palpate real quick, okay? Palpating that parotid duct and your Wharton's duct. Stenson's and Wharton's. Great. No changes there. Perfect. Alrighty. So that's good with that. Did I miss anything? Now we're going to move on to your neck and thyroid. Did you have hand sanitizer? Not to bug you. Okay. So first I'm just inspecting your neck, looking at the anterior, posterior, lateral areas of your neck, checking out your sternocleidomastoid here. I'm just going to palpate. All right, and then looking over at your trapezius in the back here. Any tenderness in those areas? Nope. Great. Now I'm just going to palpate your trachea here and kind of move it side to side. Not seeing any deviations, looking like it's going back to midline every time I move it. Perfect. All right, so now we're going to palpate a few nodes, some lymph nodes, see if you have any tenderness in those areas, okay? All right, so first this is the pre-auricular. Do you feel any tenderness in here?
Nope.
Post-auricular? Any tenderness here?
Nope.
All right, then I'm going to move down to, over to your occipital. Any tenderness in here?
Nope.
Okay, and then down to your your mandibular one. So, is this superficial? No.
Submandibular.
Submandibular, yeah. Any tenderness in here?
Nope.
And then your submental here?
Nope.
Any tenderness? Great. Then I'm going to move down to your superficial cervical. Any tenderness in there?
Nope.
Great. And then your posterior cervical back here. Any tenderness?
Nope.
Great. And then your tonsillar. I missed those. Those are back here. Any pain?
Nope.
All right. And then your deep cervical are kind of back here. I would kind of dig in there to feel those. Do you feel any tenderness back there?
Nope.
Great. And then last thing I want to do is your supraclavicular, so kind of up in here. Any tenderness?
Nope.
Great. All right. Now what we're going to do is inspect your thyroid. I'm just going to stand to the side of you again. I'm going to kind of feel for your isthmus of your thyroid. All right. And I'm going to have you swallow. Perfect. And one more time, swallow. Great. And swallow. Great. One more time. Cool. Alright, you did good. Making sure that those movements were symmetric. Feeling the lobes of your thyroid and stuff like that. Yeah. Do you have any questions for me? That's it for our test.
Nope.
Great. Well, thank you.
Thank you.